Hello, Mr. Gregorio.
Hi. Hey there, Dr. Jackson. Hello, team.
Good to see you.
Nice to virtually meet you.
Yeah.
I'm in my office. I am behind closed doors, so don't worry. I'm staying protected.
Oh, okay. Okay.
Anthony, good to see you again.
Hey, Dr. Ray. Hey, Gene.
Roz, as far as you know, everyone will be able to attend?
I did not get anyone saying that they would not be here or late.
Okay. All right, we'll start in 1 minute. All right, so it is now 5 o'clock straight up. I'd like to call to order the meeting of the Durham County Board of Health this day, February 10th, 2022. Happy New Year, everybody. Okay, I want to take this time to welcome our new board member, Mr. Anthony Gregorio. I'm going to give him a chance just to give us, I told him last night he can have 30 seconds, but he may take a minute just to give us a quick introduction. And then we'll go around and introduce who we are, our positions, and how long we've been on the board. Okay. Mr. Gregorio.
Awesome. Thank you, Rosemary. Good afternoon, everyone. My name is Anthony Gregorio. I am a Bull City native, and I'm one of your local neighbors. I have a background in public health and healthcare finance and advisory. I've worked at Duke Regional and Duke Hospital, and most latest working for a healthcare device company in Cary, North Carolina. So I'm really looking forward to leveraging my background into providing equitable healthcare outcomes for my community. So be very proud to be on the board.
Great. Welcome. Welcome. Glad to have you. I'm going to call you all as I see you on my screen. So Spence.
Okay, I've been a member on the board for 6 years and just got approved for my 3-year additional term. My career started in public health in Michigan doing environmental health, and moved on to work for IBM, who my division became Lockheed Martin, and I was a senior facilities ESH engineer. I guess that's about all to tell you. And that's
All right,
my
very
puppy
good.
barking.
Thank you. Yeah, I hear your puppy. All right, thank you. Dr. Ordo.
Welcome, Anthony. I'm Vicki Ordo, and I have been on the board going on 3 years. I think I just hit my 2-year mark, if I'm not mistaken. And I am the Chief Nursing Officer at Duke Regional Hospital, and I have been there for 13 years.
Great, thank you. Dr. Ray.
Hey, Anthony. We've had the pleasure of knowing each other, working in the past. Jean Ray, pharmacist member on the board, just starting my 2nd year on the board. An associate chief pharmacy officer at Duke Hospital, where I've been for the last 15 years. So welcome.
Okay, our health director.
Mr. Gregorio, you've joined a fantastic bunch. I'd say from time to time, and I'm a little bit biased, but this is the best board of health in all the land on this side of heaven. Glad to have you. We've certainly read your bio and quite impressive. Thank you for your community service and your service to Durham County.
Great.
Thank you, Rod.
Thank you. Attorney Wardell.
Brian Wardell. I've been representing the board for the last 11 years now. So I've seen a number of faces come and go. I think I would agree with the director that this is the best board of health I've ever dealt with, the only board of health I've ever dealt with, but a group of very intelligent, thoughtful professionals, and I think you'll fit right in. I've been with the county attorney's office for 11 years, and the Board of Health was my first client. I've got a background in public health. I've got a master's in public health from University of North Carolina in Chapel Hill. So every once in a while I'll throw my 2 cents in, but usually I just stick to the legal side of it. Good to have you.
Thank you. Dr. Braithwaite.
Hi, Anthony. I'm Mary Braithwaite, a pediatrician at Chapel Hill Pediatrics. I live in Durham, and we have a Chapel Hill office and a Durham office. And I'm happy to be here and happy to have you here with us. I think this is my 7th year on the board. So welcome, welcome.
Yeah, and Dr. Braithwaite is our vice chair. Okay, Josh.
Hey, good evening, Josh Brown. I want to apologize. Looks like my camera must have got dropped or something. I have like a funhouse mirror going on here from what I could tell. But
no, we can see you fine.
You see me fine? Okay, it looks like a really large to me. Yeah, I've been on the board for about 2 years now. Most of my experience has been in academic research, Virginia Commonwealth University and UNC Chapel Hill. I am currently a financial analyst at Humana.
Thank you. And Dr. McDougall.
Hi, Anthony. My name is Roger McDougall. I have been on the board 2 years, maybe going into the 3rd, and I am serving as in the dentist position on the board. So welcome. Looking forward to working with you.
Okay. And then Dr. Miller.
Yeah, I'm Dr. Miller. I'm holding the veterinary position. I'm a small animal veterinarian. I have served 3 3-year terms, took a short little break, and now I'm in my next group of 3. So I think that comes up to about 11 years or thereabouts. So look forward to working with you.
Okay, thank you. So thanks, everybody. We look forward to working with you, Mr. Gregorio.
Great, thank you.
All right. I think missing from the agenda is roll call, but I think roll call is next. Oh, I'm sorry. Before that, any adjustments to the agenda? No. Okay.
Dr. Jackson, we
Yeah, we need to do roll call.
put the operating procedure on. That will be an adjustment.
That's going to come under the Personnel Committee report.
Oh, okay.
Yeah. Okay, so I think we need to do roll call before we vote to approve the agenda.
We need a motion to approve the agenda.
Before we do the roll call?
Yes,
Before we
ma'am.
do the attendance? Before we do attendance?
Yes, ma'am.
Okay. All right, so I'll entertain a motion to approve the agenda.
Motion to approve.
Second? Okay, we'll take a roll call vote.
Chair Jackson,
Approved, yes.
Dr. Miller,
Approved.
Dr. McDougall,
Approved.
Mr. Curtis,
Approve.
Dr. Braithwaite,
Approved.
Dr. Orto,
Approved.
Dr. Ray,
Approved.
Mr. Brown,
Approved.
Commissioner Alam, and Mr. Gregorio.
Approved.
Okay. Thank you.
All right, very good. Motion passes. All right, so since that was essentially a roll call, I don't think we need to do a separate roll call. We're just missing Commissioner Alum. All right, so the minutes were sent to you and hopefully you had a chance to review them. So we'll need a motion to approve our last meeting minutes.
Motion to approve.
Second.
Okay, it's been moved and seconded. Roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall,
Yes.
Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Oto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Mr. Gregorio.
Yes.
Okay, motion passes. Minutes approved. Any public comments?
No, ma'am.
Staff and program recognitions, Director Jenkins.
Thank you very much, Madam Chair. At this time, it's a pleasure for me to defer to Deputy Director Liz Stevens, who is going to introduce our newest addition to our leadership team. She is our Allied Health Director. This time, we'll pass it on to Liz Stevens.
Thank you so much, Rod. Good evening to the Board of Health. It's a pleasure to see you all, as always. I am delighted to introduce the newest member to our leadership team. So Josie, Paul, I'll invite you to turn your camera on to greet the board. Josie started with us this week, as Rod mentioned, our new Allied Health Division Director. We've had a series of leadership transitions within our Allied Health Division, and I'm just so pleased to have Josie coming on board with more than 20 years of experience working in laboratory leadership, supervision, lead roles. She comes to us most recently from UNC and expressed to me specifically that she was really looking to move out of hospital system work and into the public health arena just as a way of being closer to serving the community. She does have experience in the past working in public health as well. So it just brings a really wonderful array of expertise and leadership to our group. So Josie, I'll pass it to you if you'd like to just say a few words to our Board of Health.
Good afternoon, all of you. I'm happy to be here. I'm happy to meet all of you. It's been a pleasure to be able to join this public health, Durham public health family. I'm very excited to be here. I have over 32 years experience. My background is lab. Very excited to be able to join the lab, and I will be working already. I have started working on the inspection readiness. So from day 2, I joined this week, Monday, and from day 2, I dove right in, starting working on the inspection readiness. So I'm happy that I'll be able to participate in the inspection. I started right in the nick of time, and I'm happy I'll be able to make a difference.
Thanks so much, Josie.
To the Board of Health, that inspection that she's talking about is a CLIA inspection that we're finally going to receive, that we've been waiting on for some 2 years, Liz.
Yes.
So they're going to make their great appearance next week, Thursday. And I'm proud to say that we are ready. And we could not have had Josie to start at the right time. So she's quite experienced and has been through several CLIA inspections. So we got the right person for the right time.
Very good. Thank you.
I'll just add that we look forward to sharing a report with the Board of Health next month related to that inspection. Thanks so much.
All right, great. Thank you, Liz. All right, so next we have a presentation from the namesake of my favorite city, Miss Savannah. I'll turn it over to you.
All right, can everyone hear me okay?
Yes.
All right, excellent. Let's see. Oh, it looks like the host has disabled screen sharing.
I'm actually getting it to you. Just 1 second.
Okay.
You should have access now.
All right. Okay, can you see my presentation?
Yes.
Okay, excellent. Well, thank you so much, everyone, for your time and inviting me to speak with you today. My name is Savannah Carrico. I am the public health epidemiologist with the Durham County Department of Public Health. I work with Marissa Mortarboy in the Population Health Division. So I'm just going to briefly go over some of the key findings that we had from our 2019 Youth Risk Behavior Survey. I'll be referring to it as the URBIS throughout the presentation just for brevity. And I did want to point out, though, I know that the 2019 data doesn't seem as important now in 2022, but I do want to say that it is actually going to be extremely valuable, as it will serve as our baseline for pre-pandemic youth risk behavior survey data. So we're very interested to see what the 2021 survey will yield. That was completed in the fall of this year, and we should have that data within the coming months. So that's why I think it's still valuable to go over the 2019 data with you all tonight. So the URBIS is a series of questions developed by the CDC, and it covers a wide variety of topics for middle and high school students. The 6 main topics are outlined here. We have injury and violence, sexual behaviors, alcohol and substance use, tobacco use, dietary behaviors, and physical activity. So for middle school students, it's a 70 question survey, and for high schools, there are 99 questions. For the 2019 yearbus, we were able to have 12 middle schools and 11 high schools participate, and those were randomly selected. And we did have over 1,000 both middle school and high schoolers participate. About 70% of the total middle school population was able to participate. Not quite so many high schoolers, a little under 50%. And we can see that the green line here, middle school students' participation has increased since 2015. However, we are seeing a slight decrease in high school participation. So some demographics by race and ethnicity for the participants. The majority of the participants are Black or African American, followed by Hispanic or Latin students. And we had a pretty even distribution among grade levels. For middle school, we had all 3 grades, and for high school, we had all 4 grades represented. So here's a quick summary of the topics that we discussed or that were taken and represented on the survey. I did want to point out on the last 2 on the right, except for alcohol use and marijuana, outcomes for students of color were in fact worse compared to whites in every area. And I'm going to go over some of those inequities and reasons for disparities with you all in the coming slides. So let's move on to physical health. We're going to look at sleep, obesity, and physical activity. Beginning with sleep, it turns out that students that get 8 or more hours of sleep a night actually decreased from the 2017 survey. We can see that among high schoolers, Black or African American and Hispanic or Latin students were less likely than white students to get 8 or more hours of sleep a night, and that's reflected in the graph to your right. For obesity, it was great. We did discover that students that identified themselves as obese or overweight actually decreased from 2017, which is excellent news. We're moving in the right direction. You can see there are some inequities among students of color, and one reason for that could be that people of color are more exposed to fast food marketing and are more likely to live in areas without a nearby grocery store and thus have less access to fresh produce. For physical activity, almost half of all middle schoolers and about 1/3 of high schoolers reported reaching a goal of 60 minutes of exercise each day for 5 or more days during the week. We do see that white students were more likely to reach that exercise goal in middle school. In high school, however, it was the Black or African American student population. And also we found that males were significantly more likely to meet the physical activity recommendation than females. Moving on to nutrition. We noticed that students that reported eating breakfast on all 7 days of the week actually did decrease from 2017. One reason for this disparity, schools do offer free breakfast for students. However, it has been shown that that is somewhat stigmatized as being for lower income families and therefore might deter students from accepting that free breakfast. I am happy to report that the number of high school students that consumed sugar-sweetened beverages decreased significantly from 2017. This could also partially explain the decrease in obesity that we saw as well. Moving on to safety. 7% of middle schoolers and 12% of high schoolers reported missing at least 1 day of school because they felt unsafe at school. And then we see that reflected among middle schoolers, about 20%, and 1/3 of high school students reported gang activity in their schools. And the reason for that increase, you can see by race and ethnicity, that Black or African American students were much more likely to report gang activity in their high school. We know that gang activity is associated with factors such as poverty, lack of resources, and crime. The root of all of this, though, is systemic racism. We did find that students reported being bullied more in person than actually being bullied online. There was a slight increase among students that were bullied in 2017 among middle schoolers, but a significant decrease among high school students. So that was good to hear. And we do see about a quarter of middle schoolers and about 12% of high schoolers reported being teased for their sexual orientation. And we can see there's not a huge difference among race and ethnicity, but we do see that females were more likely than males to report being bullied on school property. Sexual behavior, we're going to look at sexual activity. So we have 12% of middle schoolers and almost half of all high schoolers reporting that they have ever had sexual intercourse. We do see that Black or African American and Hispanic or Latin students reported more sexual activity more than white students. There are several reasons for that disparities, one of which studies have shown that adults perceive young Black girls as having more knowledge about sex compared to white girls. And adults also perceive Black girls, even as young as 5 years old, as being older than they are. And I also wanted to draw attention to the age at first sexual intercourse. Unfortunately, we are seeing about 4% of high school students reported their first sexual intercourse experience at age 11 or younger. But the majority occurred during 14, 15, and 16 years of age. So we're going to look at depression and suicide. So about a third of both middle school and high schoolers did report feelings of depression. However, high school students that reported depression actually decreased from 2017, so that's really good news. We do see that students of color actually report more feelings of depression, and among high school students, females were more likely to report feelings of depression. And going back to the students of color feeling depression, it is directly linked to systemic racism that is associated with depression and anxiety. For suicide, I am happy to report that suicide consideration decreased among high schoolers since 2017. However, it did increase among middle schoolers. There are, again, disparities with race and ethnicity. White Americans are less resilient than Black or African American and Hispanic or Latin Americans when it comes to suicide. However, rates of suicide consideration may be higher among students of color due to differences in access to mental health services. In addition, I want to also mention that systemic racism is also positively associated with feelings of depression and suicidal ideation among people of color as well. And lastly, I'll go over substance use. So we'll start with current substance use. We found that middle schoolers were more likely, the most common substance use was the e-vape. And then among high school students, the most common substance used was marijuana. And both of these substance uses did increase among the population since 2017. So alcohol use, we saw about a quarter of middle schoolers reported ever having drunk more than a few sips of alcohol. In terms of those reporting that they had alcohol in their time, students of color were more likely to report that. However, white students were significantly more likely than their peers to report drinking alcohol within the last month. There is an increase of 26% since 2017 among white students that drank. And we also found that females were more significantly likely to report drinking alcohol within the past month. Cigarette use has decreased by 40% among high schoolers since 2017. During the 2019 survey, only 7% of middle schoolers and 6% of high schoolers reported current cigarette use. So that's excellent news to hear. That drop by 40% is a very, very good thing. E-vape use did increase among high schoolers and middle schoolers since 2017. We see Hispanic or Latin students among middle schoolers have reported more e-vape use. And one reason for that disparity is that vape shops are often higher in the census tracts with larger proportions of people of color in the population. So they're exposed to more of that marketing and therefore have easier access to the e-vapes. Marijuana use actually did decrease among middle school students. However, it did increase among high school students. And Black or African American middle schoolers were more likely to report current marijuana use. So that's the data I have for you. I do just want to acknowledge Durham County Department of Public Health, Durham Public Schools, North Carolina Healthy Schools, and the CDC, which designed the survey and analyzed the data for us. And at this time, I would welcome any questions that you have for me.
Great, thank you, Savannah. That was really good information, quite interesting. I do have just one question, because in the metrics regarding suicidal ideation, the difference in the races was huge. It was the biggest gap that I saw amongst all the others. Do you know, I'm just curious, have we had any completed suicides in our school system?
I do not know the answer to that, but I'd be happy to look into that for you.
Okay. Okay, any other questions or comments?
I had a question. I'm sorry for the echo. Savannah, can Okay, can you hear me now?
There's still a slight echo.
Still the echo.
All right, let me log off. Can you hear me now?
Yes.
Yes.
Okay. I'm sorry about the echo. I was logged in twice because I'm gonna have to leave early, I think. But so I noticed that females were reported to be more likely to be bullied and to report alcohol use. Do you have any rationale for why we're seeing that as opposed to the males?
Yeah, I don't know that. There was the difference among the sexes for that. The literature probably does have more information on that. Again, I would be happy to find that out for you.
Savannah, if you would make me back the host, please.
Oh, sure.
Thank you.
How do I do that?
Go into the participants list.
Okay.
And make Durham County Public Health the host.
Okay. Did that work? Okay, I think it worked. Let me know if it didn't.
Thank you.
Okay. Thank you, everyone.
All right, thank you again, Savannah, for that report. We're going to be real interested to hear when the 2021 data comes out. That's going to be really interesting to compare. So thank you. Okay, Board of Health questions regarding public health vacancies. Any questions or comments about that report? So I do want to comment and give kudos to all the hard work that's going into our staffing efforts, because the vacancy rate has decreased, I think, from 17.4% to 14.9% since October. So headed in the right direction.
Thank you, Madam Chair.
Okay, no other questions, the NOV reports, any questions or comments regarding that report? My only comment there, still seems like it's a lot of them, but there's activity on all of them. So kudos to environmental health as well with working on that. I noticed some have been several years, I think only several years with extenuating circumstances, but legal action is undergoing in all of those. All right. And the health director's report. I only had just one comment about that, because I was impressed with one of the entries where the nurses were able to assist the public school system with vaccines that students were missing, required vaccines. I think it was meningococcal was the primary one. And they were able to set up a clinic and have that done. And at the same time, give COVID vaccines to those students and their families. So that was great. That was a great effort. So thank you all for that. All right, our committee reports. We're moving right along. Dr. Braithwaite is our chair.
Thank you, Madam Chair. So as Personnel Committee Chair, I'm happy to report that we have a few updates for you guys. Rosalind has been so helpful in helping us keep everything together. So thank you, Roz. She has reissued the health directors survey. So if you would please, if you haven't already responded to that, please do so within the next week or two. We do use that every year to provide feedback to our director as one of our main jobs as the Board of Health, and to determine salary adjustments. So it's very important to get feedback so that we can provide that to our director. And one of our other tasks the Personnel Committee has was from our last meeting to review the operating procedure manual and to update it with a process for addressing complaints. So the Personnel Committee did meet with the Attorney Everett Perry of the Human Resources Department, and she was great along with her team at helping guide us in learning how the best way the Board of Health should go about addressing complaints that come directly to us when we do have some. And we have a process that we would like to propose. Roz did get us started with that, and the Attorney Everett Perry did revise it for us, and we'd like for you guys to review it. It's in your email box, and we can vote on it at our next meeting. Basically, the process is if anyone on the Board of Health receives a complaint, if it's a patient complaint, it goes directly to the medical division. If it's any other type of complaint, it will go to HR. But if it is a personnel complaint, it comes to the Personnel Committee first, we review, and then submit to HR for further guidance. If it's non-personnel, say it's a complaint about a violation of the smoking ordinance or NOV complaint that didn't seem to be addressed, or some question, it will go to the chair, and the chair will then review and direct to HR. So HR always gets the complaints that come to the board, and then it will either go through the chair or the Personnel Committee and then to HR, and then they give us guidance, and then we present it to the board. So does anyone have any questions about that?
Just a point of clarification. Kathy Everett Perry is the Human Resources Director. She is also an attorney, but her representations are through HR. And so the document has headed through the attorney's office, through the county attorney's office. So I just want that to be clear. Not that there's any problem, but it has not been vetted through the county attorney's office.
Okay. Attorney Wardell, she did not say that was the final. She was giving us guidance on the wording, but I would like to speak with you offline about next steps to get it properly vetted, and so we can vote on an approved document at the next meeting. Is that okay?
That's fine.
Okay, thank you for that.
Yeah, thanks.
Are there any other questions or suggestions? That was important. I should also say the other members of the committee are Dr. Orto and Dr. Miller, and ex officio, is that correct, Dr. Jackson?
Yes.
Okay.
Yes.
We
But
do
you all
need
did all the work, so I want to thank the Personnel Committee for the work. that section they did, you may look at it and say, well, it's not a very big section, but there's a lot of nuances. And so a lot of time and effort was put into that. So thank you, Mary, and the Personnel Committee for that.
Thank you. And also thank you, Rosalind, for taking
Yes.
excellent notes and writing everything for us to start it off. That was really
Yes.
helpful. So please review the revised suggested revision to the operating procedure manual, and then we will get it properly cleared and present it to you guys for March meeting vote.
Okay.
That's all I've got.
All right. Thank you, Mary, for that report. Thank you very much. All right. And speaking of Personnel Committee, so, I thought I was pretty good with numbers, but apparently not, because I thought that the personnel committees, well, all the subcommittees only needed 3 total people, but actually it needs the vice chair as the chair of the committee plus 3 others, not 2 others. So I need to appoint an additional person to the Personnel Committee and to the Finance Committee. So for personnel, Dr. McDougall will be joining the Personnel Committee. I'm appointing him today, and I have reached out to him. He has agreed to do that. So thank you, Dr. McDougall, for agreeing to serve.
You're welcome.
And then for our Finance Committee, so we're going to have him come in with both feet in. So our new member, Mr. Gregorio, is going to be added to the Finance Committee, and he has agreed to do that. So thank you both for agreeing to serve on those committees.
Thank you.
And Dr. Braithwaite is the chair of both of those committees. As vice chair, she's the chair of those 2 committees. All right, so we're going to move on to old business. I think last time we talked about getting an update on COVID for this meeting. So Director Jenkins.
Thank you very much, Madam Chair. If get Rosalind to make me the host. Thank you very much. Bear with me for just a second. Can you see my screen?
Yes.
Yes.
Okay. Go back. I must admit, I feel a little different doing this because I'm so used to doing it for the Board of County Commissioners, but it feels a little different doing it for the Board of Health. But nevertheless, I'd much rather do it for my board. COVID continues to be in our community, and I hope that you can see our epi curve. This is the tell of the tape right here. January 27th is when I announced that we had about 2 cases of Omicron inside our community. Those 2 cases for January quickly morphed into 24,000 cases.
Excuse me, Rod.
Yes,
Rod,
ma'am.
we're still on the opening page.
You're still on, I apologize. I apologize for that.
Oh, no.
Let's start
There
over.
we go. Now we have it.
You got it now? Is it in presenter mode? I apologize.
No, it's not in presentation mode, but we can see it.
Okay.
Yeah, if you could put it on slideshow, it would be big enough for us to
Better,
read though.
yeah.
I thought that's what I was doing. Let me try this again. Is it at the beginning? Are you seeing it from the beginning?
It's the beginning slide is up.
Okay.
It's the screen at the bottom.
But it's not in the slideshow mode.
If you go down to the bottom on your right-hand side,
On my
hit that
right-hand
little
side.
screen. Over,
Right here?
over, the other way. No,
Other way.
other way, right there. Whoop,
Right
you
there.
missed it. No, next one over.
Right
That
there.
one. Click it.
Right there.
Click it twice.
I promise I've done this a million times.
No, it doesn't want to do it, must be.
We're going to start over.
All right.
I apologize. Let's try this again. What's up, man? I got the big gun in here now. Share screen. Slide. And then slide. That's what I was doing from the beginning. All right. Can you see
There
it
you
now?
go. Yes.
Thank you, Larry. I do apologize, but Larry always to the rescue. Once again, thank y'all so much for your patience. Just want to really express where we are right now. I know I've some time has lapsed, but we are on the downswing of the current Omicron surge, as reflective in the 7-day moving average, which is the teal line that is drooping all the way down. Now, what's starting to happen, ladies and gentlemen, is that there's a lot of people saying, hey, you know, the worst is behind us. Let's go ahead and do away with all these mandates and all that other stuff. But it's important to really recognize that the 7-day moving average is still 244 cases. And we're still as high as we were at the peak of Delta. So we want to make sure that we continue to drum that up. But it's good to know that the cases are going down and our staff is starting to get some breathing room. Since February 1st, this has truly been an anomaly because throughout the pandemic, the African American and Hispanic population has represented most of the cases. But since February 1st, it is the white population in Durham County for the first time ever that's been representing most of our cases. And unfortunately, throughout the pandemic, it's been females that's been disproportionately affected in Durham County. The age as far as high infections continues to be that 20 to 39, 40-year-old, young, invincible, don't really believe in the science, but nevertheless, you know, it's still here and they're still getting infected. Infections per capita continues to be, trending down. So Durham County represents the solid blue line. At this particular time, I'm proud to say, in comparison to the contiguous counties around Durham County, Durham is now the lowest when it comes to infections per 100,000 individuals per day. So we're certainly on a downswing. We're happy about it. Our 7-day moving average continues to drop down. However, we're still not on par with the national average, but as of February 3rd, 886.19 was our 7-day moving average positive cases for the week ending February 3rd. One thing I'm happy about is our positivity percentage is really, really going down. And that's where you really know whether or not community spread and community infections are really starting to dissipate. It has gone from 26% to 19% to, as published on Tuesday, 11%. So we're certainly happy to see this continue to go down. But of course, the gold standard for us continues to be to getting it below 5%. Hospitalizations, of course, near and dear to our hospital partners' heart. ICU beds and regular beds are continuing to improve. Every Monday at 12:30, I have a meeting with Katie Galbraith and Michelle Lynn to discuss what's going on my side and what's going on in the hospital side. And on Monday, Katie did say that, you know, they continue to see a leveling decrease, but of course, we're not out of the woods yet because it's still relatively high. But we're glad to see that some improvement is coming. Of course, with a sustained surge, once the numbers starts to decrease, then we begin to see a lot more deaths. So we are starting to see a significant amount of deaths occur. Unfortunately, I received notification of all deaths due to COVID ever since the pandemic began. And within the past week, we've received days in which 5 deaths, 3 deaths. So it's a little bit sobering, but nevertheless, by a large margin, the majority of the people who are dying are either unvaccinated or partially vaccinated. So we still know that vaccines work. But again, 72.59 is the average age of death. And, again, we continue to see deaths by gender, particularly with males representing a large swath of the deaths. Vaccines continue to be going well, and I'm so proud of Durham County. Durham County continues to be one of the top 5 counties for vaccinations in the state of North Carolina. Right now, 73.6% represents the eligible population that has been vaccinated. So we're certainly happy about that. And we continue to vaccinate in large numbers and also provide vaccine to many, many of our partners as a vaccine hub. So we continue to do very, very well there. As mentioned, since we are on the downslope with the Omicron surge, big shout out to the Population Health Division. You guys met Savannah Carrico, our data manager, John Paul Zeta, data scientist, Marissa Mortarboy, who's the Population Health Division Director. They make up our data team, pretty much our unsung heroes, in addition to several other people from our divisions. And also, I'd be remiss if I didn't give a shout out to Medical Director for Durham County Public Health, Dr. Jeff Jenks. They came up with these possible targets for modifying our mask mandate. Those of you know, Durham County is still under an indoor mask mandate. And I tasked them maybe several months ago to really start thinking about the metrics that we can use to really start lifting the mask mandate. As such, never to back down from a challenge, they pretty much came up with these metrics, which are county transmission are below 50 cases per 100,000. Currently, we're at 78.87%. 78.87. The rate of transmission, or the R0, if it's less than 0.6, right now we're at 0.56. So again, if 1 and 2 are there for a sustained period of time, automatic lift. For positivity percentage, of course, the gold standard is to get it below 5%. Again, as of Tuesday, we're at 11%, so we're making progress. And of course, we want vaccinations to be that key metric. So the boosted population is greater than 80, got quite a way to go for that, but fully vaccinated with the traditional 2-dose, greater than or equal to 80, 73.6%. These are, to my Board of Health, proposed. They have been forwarded to Chair Howerton of the Board of County Commissioners and Mayor Elaine O'Neill for consideration. And we hope to meet sometime within the next 2 weeks to really codify this and see whether or not we're going to include this inside our declaration. So again, thank you so much for your patience. We apologize for the technical difficulties. And at this time, happy to answer any questions you may have.
Very good. Thank you. Good presentation. Some good news in there. That was good to hear.
Absolutely.
But everybody don't go crazy yet, though.
Right. I have a question.
Sure.
That was very helpful information, Director Jenkins. One thing that struck me was that the death age is 72.9 or greater. I would like to know if we could consider a campaign to boost that age group to help reduce the deaths even further. I know that my field of expertise is pediatrics, and so we have targeted campaigns. But is there a way for us to make sure that our seniors are getting their boosters?
I would say that's a fantastic question and a great idea. I will say this, it would be really, it would probably be a short-lived campaign, Dr. Braithwaite, Madam Vice Chair, because our 65 and older population is at 90.1% fully vaccinated. But I know you're talking about boosters. And if I were to pull the data for boosters, they're probably not as high as 90%, but they're up there. So the one thing that I have been saying privately to Madam Chair and many others is that our seniors, they've been through some things. They listen, they have wisdom. So there was no getting them, not getting them their vaccines. They were hitting us with their canes trying to get in here. But nevertheless, we certainly know that the majority of the deaths, Madam Vice Chair, that you're seeing of this population are truly people who are just not entertaining the vaccine. They're just simply like, no, we don't want it. I don't want it. But we certainly will talk with our vaccine operations team. I'd also be remiss in saying that we are working with the state of North Carolina, Department of Health and Human Services, on some vaccine equity, particularly around boosters. Because as you can recall, back in August, as we were going into the fall, there was this incentive campaign that we had that gave about $100 for a shot. And we had a lot of people to flood the Health and Human Services building. Well, those people did not come back for their second dose, and they surely did not get their boosters. So we met with them I want to say this morning, and we are trying our best to, kind of circle the wagon and try to get those folks as well. And I'm pretty sure some of them are of this population as well. So hope that answers your question.
Thank you.
Attorney Wardell.
Thanks, Rod. I've got a question. I also represent the planning department, and until recently, they were only holding virtual meetings. And there's discussion about having a large hearing in May. And my concern is it's an in-person meeting. How do we coordinate that? If we're still under a state of emergency, none of the requirements would necessarily apply that apply if you're going to have a virtual meeting. So if you have a live meeting, you just have to social distance and things of that sort. Is that a discussion that I need to pull you in on in terms of how we structure that particular meeting if they decide to have it? Because I know there's been some discussion with the city and the mayor about it, but there hadn't been any discussion with the county, and it's a joint city-county department. So is that something I need to pull you into?
Absolutely. And to your surprise, I'm a half step ahead of you.
Okay.
I did receive a text from General Manager Jay Gibson, and
Okay.
he asked the exact same question, and I told him, I said, of course, anytime you guys need some guidance, we're always here for you. So within the next 7 days, we hope to convene to really talk about this very subject.
Okay. All right. Thanks.
Yes, sir. Dr. Ray.
Yeah, thank you, Mr. Jenkins. Just a compliment and a question. First, the compliment, just all the testing and the success in the testing that's been ramped up. I personally had a short turnaround to get a test with my family a couple weekends ago on a snowy, rainy, blustery day, and it was fantastic service we received, and I know that's continuing. Just wondering what the plans were as the positivity rate goes down for the current testing sites that are up and the availability of those. I know there's been a lot of good work that's been done, but certainly that likely doesn't need to continue at the same level that it is today.
Indeed. Very good question. Thank you so much for the compliments. I give all praises to the vaccine operations team, the testing team, our preparedness coordinator, Corey Morris, and his partnership with OptumServe, which is a state-supported vendor. They've been very helpful to us. And also our newest partner, which is Curative, who is doing, they're doing testing at DPAC and also Durham Technical Community College. So please excuse me for the shameless name drops, but gotta recognize them because they're doing some good work. We have kind of like a well-oiled machine. Pauline Bridgman is like our main point of contact with OptumServe. And when they see if a Wheels or Durham County Memorial Stadium or El Centro Hispano is starting to level off, then they'll let us know like, hey, we need to shift these assets to those areas that are, a little bit more fluid in their activity. So we've been doing that technically since we began testing here in Durham. We still also maintain excellent relationships with Courtney Herring, who is over CVS, and also under governmental relations, and several people from Walgreens. As you probably can recall, I was jumping up and down and really hollering like, hey, we need you in Durham. But we've maintained those relationships. So when all else failed, if our state-supported vendors start to dissipate, then we still have multiple sites with CVS and Walgreens. So we keep a watchful eye on that. We have a meeting with them at least once a week just to really test the temperature to see whether or not we need to shift assets. And that's continued to work well. So it's been a lot of work over the course of 2 years, but worthwhile work because it's continued to keep Durham safe.
Wonderful.
Attorney
Thank you.
Wardell, I don't know if that's an old hand and a new hand.
Yeah. Attorney Wardell, is your hand a new hand or that's an old hand from a previous question? Your hand is raised on the screen.
That's an old hand
Oh, okay.
in more ways than one.
Back to you, Madam Chair.
All right. Thanks again for that update, Rod. That was very good. Thank you. All right. Now to new business, budget amendments. Looks like we have 3 of them.
Yes, ma'am. The first of which was a budget amendment to recognize $71,990 from the North Carolina Department of Health and Human Services Division of Public Health, Epidemiology, and Communicable Disease Section Branch. This is strictly for our refugee arrivals in Durham. As you well know, we have received quite a few refugees here in Durham. We welcome them. There's a huge press conference that was sponsored by former Mayor Schul and many others to welcome them to Durham. The number of screenings has gone up dramatically from 160 to a total of nearly, really a new total of over 1,000. So we are certainly thankful for these funds. We stay in contact with the state health department, and that's what these funds are for. The second was a budget amendment to appropriate general fund balance in the amount of $125,000 for jail medical care, amending the jail health contract. This is a long-standing protocol that we have. As you can recall, Board of Health, Public Health manages the jail health contract, and that's with a company called WellPath. And we have it set to where if healthcare costs exceed the budgeted cap arrangement of $400,000, then a budget amendment has to be done for $125,000 or a certain specific amount in order to cover those costs. And basically that is what this is for. And the third one, Madam Chair and Board of Health, was simply—
I have one question about the jail health one. So
Sure.
the increased cost in healthcare, was that primarily due to COVID, or did they have any other catastrophic thing happen? Was COVID
What I'm
related?
told, Madam Chair, is basically due to costs involved with COVID. And WellPath is having a tough go at it, as most healthcare organizations are. And I am sure, I'll be talking to this great board a little bit more about WellPath in the future, since we are kind of moving to a more robust posture in our meetings. Certainly delighted to have the assistance of Attorney Wardell in some of those discussions and everything. But for the meantime, in between time, this is something that they need right now.
Okay.
And finally, the last board action was to relocate and abandon Ferguson Cemetery. And that is basically it for the budget.
I did have a question about the moving the cemetery. My family had something similar in South Carolina. So, but this is truly an abandoned cemetery that nobody when I read through it, so nobody has claimed these bodies or anything. It's just
as far as I know, Madam Chair, correct. This is truly an abandoned cemetery.
Okay.
And that is it for your consideration.
All right. Any other questions or comments for Director Jenkins regarding the budget amendments? And I think so. Do we want to approve all of these together, or should we do them one by one?
Believe you'll be fine doing them all together. Correct me if I'm wrong, Attorney Wardell.
Yes, that's fine.
Okay. All right. So I'll need a motion to approve the 3 budget amendments requested.
Motion to approve.
And second?
Second.
Roll call vote.
Chair Jackson,
Yes.
Dr. Miller, Dr. McDougall,
Yes.
Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alam,
Yes.
and Mr. Gregorio.
Yes.
Mr. Anthony, thank you.
Oh,
Thank you.
thank you. Okay, motion carries. All right, informal discussions. I did have one thing I wanted to just ask the board. From time to time, well, a couple of times that I'm remembering quite well, we've needed to get in touch with you all quickly. And for some of you, we only have a daytime work address. So when something happens after hours, we can't really get you unless we try to email you and hope that you see it soon. So if you wouldn't mind to give Roz your cell number where we can reach you. Not right here in this open meeting, but sometime here in the next few days, if you could give that information to her, we appreciate it. And I won't abuse it. I won't call you all the time. Okay, thank you. Anything else for the good of the order? Okay, topics for next meeting. I actually skipped all that. Of course, and now we're going monthly, so we'll get, continue to get updates about COVID.
Madam Chair, it sounds like we have the CLIA inspection report that will be
Oh,
on for the March
that's right.
meeting.
We have some other things, yeah. And I think I saw an email where it's Will on. I think Will Sutton wanted to be on the agenda next month.
Absolutely. We will be delighted to present you all with the budget for fiscal year 22-23.
Okay.
And
All right.
then
So, yeah. We have to vote for the
operating
manual.
procedure.
Okay.
I'm curious at some point, I'd love to hear about the services that we're providing to the refugee population, especially as it's growing. I don't know if for a March meeting or maybe April.
Maybe April.
Yeah, that's a great idea.
Yeah,
We
that
can
is.
be happy to set that up for the April meeting. I know that the March meeting is probably going to be jam-packed.
Thank you.
Okay, yeah, that'd be good. All right, thank you. Okay, if there is nothing else, I'm going to, and I have to read this. So I need a motion to adjourn into closed session pursuant to North Carolina General Statute Section 143-318.11, parentheses 3 and parentheses 7, to consult with an attorney employed or retained by the County of Durham to preserve the attorney-client privilege and to discuss a matter related to planning, executing, and reporting an investigation regarding an allegation of criminal misconduct by a former employee. And a motion to adjourn into closed session pursuant to North Carolina General Statute 143-381.11, parentheses A, parentheses 3, and parentheses 6, to consult with an attorney employed or retained by the County of Durham to preserve the attorney-client privilege and to discuss a personnel matter.
So moved.
May I have a second?
Second.
Roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall,
Yes.
Mr. Curtis,
Yes.
Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yeah.
Mr. Brown,
Yes.
Commissioner Alam,
Yes.
and Mr. Anthony.
Yes.
Okay, so Roz, you're gonna take
I'm
us
going to
into-
move you guys over. And